Hey everyone, this is Earl Stephenson Jr., your Atlanta Board Certified Plastic Surgeon, and welcome back to Sketches in Surgery. This is our last episode in the series for gynecomastia. We've talked about in the previous 3 episodes types 1, 2, and 3. We talked about causes, treatments, and now we want to focus on type 4. So type 4 is where you have 3 issues in my mind. Now move over here. You have excess skin, excess fat, and excess glandular tissue. The breast itself usually takes on more of a shape of a female breast, with actually drooping of the breast below the natural crease, which again lends to more or less of a masculine chest. You can see depicted here, we have the pectoralis major muscle, we have excess skin and fat of the chest. And what we do in this particular type of gynecomastia is to address each of these areas or issues in its treatment. Let's move here. Try not to make you dizzy. What we want to do is remove the excess skin, and that's really going to be a more traditional incision. And we'll talk about 2 incisions that are used. One I like and one I hate. So you're going to have an excision or a healed surgical incision at the end of your recovery period. We're going to also remove the excess fat and gland. You can do that with liposuction, but it really is not helpful because this is mostly a purely excisional surgery, meaning we're removing skin, gland, and fat at the same time. We don't break it up like in the other types where we will liposuction for the majority of the procedure to contour the chest and then make a smaller incision to remove glandular tissue just beneath the areolar, and then sometimes add energy in the form of vaser liposuction or some other modality to give us shrinking of the skin by warming up the collagen aspect or component. This is purely removal of all of those tissues in one fell swoop. So that's really how we treat this. It's fairly straightforward, but it's less desirable for most clients because no one really wants a healed surgical incision of any length, and certainly not one that can be very noticeable. When men take off their shirt, they still want to make sure that their incisions are not somewhere that doesn't lend to an aesthetic outcome or look. So that's why it's important to differentiate the 2 incisions that I'm going to talk about here in a second. But before I move on to that, you can have a component of the treatment be a free nipple graft, plus or minus, depending on what type of incision you use. So that segues us back to the incision. So let's focus on this drawing. Frontal view, as you can see, again, a more of a female shaped breast. So there are 2 types of incisions that can be used. One, it's more of, and I'm going to draw over here, it's more of an inverted T type of incision where you end up with this type of closure, and you do not remove the nipple, but you preserve the nipple on tissue beneath the skin, and you end up with a more contoured chest, but an incision, in my opinion, that does not look masculine. And let's draw that. I'm going to use this side for that type of incision. So we'll just erase here. We'll kind of improve the contour. All right, so now let's do this. Perfect. So we have that shape, which is great, but we have this incision. That is not so great. That is not what anyone expects, man or woman, when a man or a young man takes off his shirt. I just don't think that's a really good treatment option. What we want to do is create the contour we want with an incision that's totally within the natural crease of the breast or chest. So how would you do that? My preferred method would be to use an incision that ends up more like this. It's just a straight line. So what I would do is I would go around and remove the nipple, skin, excess fat, excess breast tissue in this football shaped pattern. Then once that is removed, like so, I take the nipple off so that we have the nipple, and this will eventually be a free nipple graft. So outline, remove skin, fat, breast tissue, and nipple. I'll get just a little closer. Once that's removed, then I remove the nipple and preserve it. So once that's done, we've got the area removed. And let me go back here. That's a little too wide, so let me go back here and I'll lean in. What we do then, once that's done, then we just go ahead and remove this. Q-tip seems to work great for smaller areas. Now, as opposed to this result, we're going to have, and actually I'm going to do something here. We're going to have this. And now we've got that incision at the natural crease. And just for completeness, we take the nipple that we've taken off, I flip it over, and I take the fat off the back side of the nipple to thin it out, and I place it strategically. And actually, I'm going to use a different type of color. I'm going to use this. I'm going to draw the pec muscle. And actually, I'm going to use the blue to represent the nipple. When I take the nipple off, we want to place it in an aesthetic position for a male. In a woman, the nipple is more centered on the chest or breast. With this type of incision, you get that centering again, which lends to a less masculine outcome. So when I have a free nipple graft, I have really the latitude to put the nipple anywhere I want. I can put it here, being silly, put it there, put it wherever I want. But what I really want to do is I lean in. I really want to put that nipple a little off the midline. So I'm going to draw kind of an imaginary line. And I want to put it right about there. That is the placement, a little off the midline, more toward the armpit, just slightly. and reduce the size of it so that it looks more masculine. So it's below the edge of the pectoralis muscle. Some people say it actually sits on the edge of it. So if we were to draw that maybe more anatomically, it actually sits just at the lower edge of the pectoralis muscle if you had x-ray vision and could see through. In the other result, where you have this inverted T or anchor incision, it sits way too high. And I'm going to draw the pec muscle over here just to illustrate that. It's way too high. So I favor basically an in block or complete mastectomy, removing skin, fat, nipple, and breast tissue, free nipple graft, and placement of the new nipple in a more favorable position for our male clients, and having an incision that is more, again, more masculine in a sense that it sits at its natural crease. Now that we've talked about all types of gynecomastia, we finished up with type 4, which there are essentially two procedures that can be done. One is a very favorable masculine procedure, and that is a subcutaneous mastectomy and free nipple graft. The other, in my opinion, is less desirable, which is more like a breast lift that would be traditionally performed in women or female patients. I hope you've enjoyed this series. I've enjoyed bringing it to you. Look for more series such as this and more information on gynecomastia moving forward with before and after pictures, patient testimonials, and so forth. If you've liked this content, please leave a comment or like or subscribe to this channel. It's really helpful. Until next time, this is Earl Stephenson Jr., Atlanta board certified plastic surgeon.